If you are someone who has suffered from Bell's palsy, then you would have definitely heard of this term called as Ramsay syndrome. Symptom-wise, Bell's palsy and Ramsay syndrome will look almost similar, but these two are different conditions. What is the difference between these two conditions? We are going to understand that in this video. Let's get started. Ramsay syndrome and Bell's palsy sometimes are used interchangeably, which is not correct. Both of the conditions are different. Even though the symptoms are very similar, these two conditions could be very different, and it also has its impact on its recovery timeline and how the treatment overall goes about it. So let's understand some basic differences between Ramsay syndrome and Bell's palsy. So first, let's talk about the cause. When it comes to Bell's palsy, the cause majorly is idiopathic, which means the cause is not known, or else it's due to an inflammation happening inside your ear, and sometimes it's due to reactivation of dormant viruses in your body. Whereas when it comes to Ramsay syndrome, this is particular problem that happens due to infection caused by reactivation of virus named varicella zoster virus. When it comes to onset, the Bell's palsy onset will be sudden. All of a sudden, a person will have facial paralysis. Sometimes there will not be any other symptoms as well. Whereas when it comes to Ramsay syndrome, patient usually will complain of red rashes around the ear region, sometimes blister being formed around the lips or else near the ear pain and headaches as well. The onset of Ramsay syndrome is gradual in nature and has associated symptoms as well. Now let's understand type of paralysis that will happen in Ramsay syndrome versus Bell's palsy. Well, when it comes to the paralysis, in both the situation, the paralysis is common, and which is the lower motor neuron type of paralysis, which means one side of the face will be completely paralyzed. Now let's talk about the ear symptoms. Ear symptoms are very common when it comes to facial paralysis, but when it comes to Bell's palsy, the symptoms are lesser compared to Ramsay syndrome. A Ramsay syndrome patient usually will complain of discharge of fluid from the ear pain and rashes around the ear. Pain will be mild in case of Bell's palsy, whereas in Ramsay syndrome, the pain will not be felt much after the Bell's palsy has developed. When it comes to impact on hearing and balance, Bell's palsy has near to no impact on hearing and balancing capabilities. Whereas when it comes to Ramsay syndrome, the patient might suffer from severe or moderate hearing loss and vertigo when there is 8th cranial nerve involvement as well. Two other nerve gets involved when it comes to Bell's palsy and Ramsay syndrome. Well, in Bell's palsy, no other nerve gets involved. But when it comes to Ramsay syndrome, the 8th cranial nerve also can get impacted sometimes. And in rare scenarios, the 9th and the 10th cranial nerve is also affected. Talking about the prognosis, which means the recovery timeline, the recovery timeline of Bell's palsy is good and fast compared to Ramsay syndrome. When it comes to medication, Bell's palsy is usually treated with the help of corticosteroids, whereas Ramsay syndrome is treated with the help of corticosteroids combined with antiviral medication. When we look at the factors of age, Bell's palsy can happen at any age, but is common between the age group of 20 to 40 years, whereas Ramsay syndrome is more common among people who are beyond 40 years. But this is just in data, but we have seen in our practical experience, people from any age can suffer from Bell's palsy or Ramsay syndrome. Now, what triggers Bell's palsy and Ramsay syndrome? When we talk about Bell's palsy, certain triggers like cold exposure, stress, upper respiratory tract infection can give you Bell's palsy. Whereas in Ramsay syndrome, it is triggered by stress, immunosuppression and reactivation from childhood chickenpox. What is the diagnostic test that can help you to evaluate and see the recovery is proper or not? Majority of time, blood work, CT scan or MRI scan, and EMG test and nerve conduction blink reflex test are done to understand the cause, at the same time the recovery rate of the condition. Is eye complication involved with Bell's palsy? Well, the sooner the eye movements come, the better it is. Bell's palsy has got faster and better prognosis. That's why eye complication chances are less compared to Ramsay syndrome, where the blinks can take a real long time to come back. That's where the risk of eye complication is much higher. Talking about recurrence, Bell's palsy can happen to anyone and can recur as well. Whereas Ramsay syndrome recurrence is rare, but in case of immunosuppression, Ramsay syndrome can also recur. However, the treatment line almost stays the same, but the medical management side changes here very significantly. That's why it's always important to see your doctor at right time to work on your recovery process. I hope this information was helpful for you. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. On that note, I'll end this video here and see you in another video. Thank you.